Welcome everyone to the Countdown to Keele webinar series. We will give everyone just a few minutes and then we'll get started. Welcome everyone. I'm Kelly Grant, Vice President of Admissions and Business Development for Caron Treatment Centers. We're excited to have you today in the second of 6 webinars focusing on the Keele Center, our new state-of-the-art 100,000 square foot medical center in Delray Beach, Florida, that is scheduled to open in January of 2023. Thanks for joining us as we count down to Keele. First, we're going to do some housekeeping items. Today's program will be conducted in webinar format, meaning we cannot see or hear you. However, we want to engage with you, so please use the Q&A feature at the bottom of your screen and ask questions, and we will do our best to get to those. If we run out of time, please know that someone from Caron will follow up with you to make sure that your questions are answered. And please note that today's program does not include continuing education for professionals. And lastly, we will be recording today's session and it will be posted to Caron's YouTube page. Today, I'm really excited. We have Dr. Caron. She has a beautiful last name that unfortunately my Kentucky accent does not allow me to pronounce correctly. So instead of butchering it, I just call her Dr. Caron, which you can too, unless you're really good at rolling your R's. But Dr. Caron is our Senior Clinical Director of Ocean Drive and soon to be the Senior Clinical Director of the Keele Center. As Ocean Drive's clinical director, she provides oversight, supervision, and support for Ocean Drive's clinical staff, ensuring that the patients receive the highest quality, evidence-based, and compassionate care. Prior to coming to Caron in 2022, Caron served for almost 12 years at the Department of Veterans Affairs, and she supervised, a staff of clinicians who provided care for veterans with PTSD, substance use disorders, and a range of mental health issues. She is a licensed clinical social worker, and she's certified in cognitive processing therapy for trauma, integrative behavioral couples therapy, primary care mental health integration model, and as a clinical hypnotherapist. In addition to that, she is also a level 1 yoga instructor, and she's trained in mindfulness-based stress reduction techniques. And she serves as a graduate level adjunct instructor at Florida Atlantic University. Caron has her Doctor of Social Work and Master of Social Work from Florida Atlantic University, as well as a Bachelor of Business Administration from St. Mary's College. Next, we have Ben Williams, our Executive Director of Florida Operations. Ben oversees and manages the Florida continuum of programming, including Ocean Drive, Renaissance, Caron Florida's new mental health program, and the Keele Medical Center. He started at Ocean Drive in 2015 as a counselor assistant and expanded his role by learning both the clinical and operational aspects of Ocean Drive, taking on roles of both the evening operations manager and the program manager at various times. Ben holds an MBA with a concentration in healthcare management from Bellevue University. And before I hand the program over to Caron and Ben, we'll play a short video that shows our construction progress as well as some of the amenities that the Keele Center will offer.
Welcome to Caron Treatment Center's new state-of-the-art medical center, Delray Beach, Florida. This construction started back in 2021, and as you can see, we are making tremendous progress. The Keele Center will be a 40-bed, 100,000 square foot building, which will have a residential older adult program and expanded Ocean Drive programming, allowing for 8 additional beds at a residential level of care. It will also have 24/7 medical care that includes an on-site detox staffed by board-certified and credentialed experts. We look forward to expanding Caron's services in Florida.
Welcome everyone to the Countdown to Keele webinar series. We will give attendees a couple of minutes to sign on before we start. Bear with us as we have technical issues from our YouTube page, but I think we're good now. And I will now hand the program over to Taryn and Ben to describe the Ocean Drive residential program at the Keele Center. Thank you both.
Thank you, Kelly, and thank you to everyone joining us today to learn more about Caron's expanded Ocean Drive programming at the Keele Center and how it will enhance our future treatment of our patients. But before we start with what's new at Ocean Drive, I'd like to provide a little bit of background on the program. Ocean Drive opened in 2011 when we saw the need in our treatment community to serve individuals and families whose backgrounds and unique issues needed programming designed specifically for them. A cornerstone of the Ocean Drive programming is a heightened level of discretion. We trained with experienced, prominent professionals to educate our staff on the cultural competencies needed to work with families of means and ultra high net worth, whether self-made or generational. Ocean Drive currently offers 2 manor-style residences with the privacy and comfort our patients have come to expect. We have a total of 14 private rooms at these homes, which are a short distance from our clinical offices where we do the majority of our programming. And looking at where we can continue to grow and serve our patients to the best of our ability, we found that offering varying levels of care within the Caron continuum was incredibly important, which brings us to today and our discussion of the expansion of the Ocean Drive programming.
Thank you, Taryn. Our Ocean Drive program has proven to be highly successful over the past decade, but we found an unfulfilled need for individuals who required a higher level of medical care or a more structured living environment. With the opening of the Keele Center, we can meet those needs with our new Ocean Drive residential program, and it will consist of 8 private rooms with clinical and medical services all available in one convenient location. The Ocean Drive residential treatment milieu will provide a small, intimate, safe, and supportive environment for like-minded individuals to relate to one another while navigating the stresses at home or in the family system, work, recovery, medical, and clinical needs. The program provides an elevated treatment experience that treats every patient with dignity and respect while offering education on recovery principles and highlighting barriers to recovery that are specific to the patient population and each of their long-term recovery needs. Amenities integrate comfort into treatment and meet the distinctive needs of both executives and those of affluence. Subsequently, such amenities have been placed on the first floor of the medical facility for convenient use by the patients when clinically and medically appropriate. Here you can see renderings of the gym, our nail salon, and the massage room. And here you can see renderings of the pool and dining room.
And I just wanted to say a little bit about our team here at Ocean Drive. The Ocean Drive residential interdisciplinary team will consist of a director of addiction medicine, a psychologist, a psychiatrist, a neurofeedback technician, highly experienced licensed behavioral health therapists and family therapists, a clinical director, a spiritual counselor, wellness staff, as well as highly trained residential counselor assistants. The treatment team works collaboratively with the patient, referent, and family to develop a customized treatment plan to fit each patient's needs and goals. I want to thank you for your time today, and I'll turn the program back to Kelly.
Taryn and Ben, thank you for that comprehensive overview of the Ocean Drive residential program at the Keele Center. I've worked with many Ocean Drive patients over the last decade, and this expansion is going to be a welcomed addition to what's already an amazing program. And the impact it's going to have not only on the Florida community, but the treatment industry as a whole will be incredibly meaningful. And I'm just so excited for it. So now we're going to shift gears and answer the questions that came in from many of you when you registered. And again, I just want to remind you, if you have questions, please just use the Q&A feature at the bottom of the screen, and hopefully we will have time to get to those. And if not, we will certainly follow up with you after this. All right, let me get the questions pulled up here. All right, the first question we have, and Taryn, actually, why don't you take this one? The question is, what are some examples of treatment barriers facing this population?
Oh, that's a great question, Kelly. So people of high net worth, notoriety, and celebrity status, or who have enjoyed a high level of success or recognition in business and industry, have a lot of difficulty entering treatment. The demands of their station or status may prevent them from taking time for treatment, or their business or office may not be able to operate without them because they are the brand. Furthermore, many people of this status experience daily intrusions of their privacy and spend small fortunes trying to protect that. For many, entering treatment poses a potential risk to privacy, a risk that could equate to loss of the support of their investors, constituents, fans, or customers if their treatment concerns were exposed. So often, a need to preserve confidentiality or privacy can serve as a barrier to treatment. And finally, the lifestyle of this population revolves around the freedom to do whatever they want to do when they want to do it. Access to anything at any time is a characteristic of this type of lifestyle. So knowing that avoiding alcohol or drugs or other compulsive behaviors can be difficult and nearly impossible for some trying to enter treatment or sustain recovery. So at Ocean Drive, we've taken a very strategic approach to removing some of these barriers. We've built in time for individuals to attend to business needs without compromising clinical care. We have a streamlined process in place to protect our patients' privacies, to include private entrances, garage and elevators to our facilities, key card access to Ocean Drive treatment areas, only certain people would be allowed in. We employ the use of alias and medical record lockdown when needed. We also have a very active alumni community who host a variety of recovery-oriented and events and groups across the nation that are aimed at supporting and exemplifying life in recovery for our Ocean Drive alumni.
Thank you, Taryn. I know over the years, many of what you just addressed, that often comes up as the reasons or excuses, whichever it may be, for why people can't go to treatment. So great to hear how we're going to handle that to remove any and all barriers to hopefully helping people achieve recovery for life. This next question, actually, Taryn, I will have you answer this one as well, please. Can you tell us how group therapy is integrated into treatment at Ocean Drive?
Of course. Well, the research shows that group therapy is the most effective modality when treating substance use disorders. Therefore, we've created a very clinically significant, sophisticated group therapy program. The research says group dynamics have a very powerful impact on recovery, and that people can gain a much greater insight into themselves when they are in a group setting. However, every patient at Ocean Drive is thoroughly evaluated upon admission, and then their treatment team determines how much and what type of individual therapy is also indicated to best meet their clinical needs. That being said, Ocean Drive offers a full complement of group therapy. Our patients are most likely to experience some combination of psychoeducational, DBT skills-based, cognitive behavioral, family, process, and experiential groups. We include also a number of specialty groups depending upon the needs of the MILU, and this might look like gender-specific, spirituality, or trauma groups.
Thank you, Taryn. Ben, can you touch on how families are involved in treatment at Ocean Drive?
Sure. Thank you, Kelly. At Caron, Florida, we've always believed in the following phrase: the patient is the family and the family is the patient. And we truly believe that. With this in mind, we carry this mindset into our Ocean Drive programming, where each patient is assigned a dedicated family therapist upon admission. Family therapists will work with the patient and a referent on determining which family members to involve in the treatment process, and will provide corresponding weekly updates throughout the course of treatment. If clinically indicated, family members are invited to participate in person in the treatment process, whether it be a few days or even a week. as part of our residential family program, otherwise known as RFP, where the family members are immersed in treatment just like their loved one and attend daily programming. Even if the family member isn't struggling with a substance use disorder or a significant mental health diagnosis, we know that everyone is more likely to do better when we deeply address family dynamics that have at times been present for decades. For those that do not need this intensity, we also offer clinical impact visits, also known as CIVs, that may only be a few clinical sessions for a couple days. We firmly believe that when patients and families heal, the outlook and outcome for both only strengthens and improves.
Thanks, Ben. I actually love this next question. And Ben, I'll just give this one to you as well. How does Ocean Drive not get stuck in the luxury treatment category?
Another good question, Kelly. Thank you. While we offer world-class amenities to our patients, including our manor-style-like homes along the beach, private chefs, housekeeping, and our upcoming Ocean Drive suites at Keele, our programming is both clinically and medically driven, meaning we offer a highly individualized treatment program that is able to address, support, and oftentimes accommodate the specific needs of our patients and their families. Our approach was to decrease the barriers to entry in regard to treatment while offering our patient demographic similar amenities that they're used to in their everyday life, in hopes that it would shift their focus onto why they're in treatment to begin with: the exceptional clinical and medical care that we provide. We are not a good fit for individuals who just want to dry out, dictate their care, and don't want to actually do the hard work that is required to experience our mission statement, which is recovery for life. We expect a lot from our patients, but we simultaneously do our best to ensure they're comfortable, as we know that by removing barriers, they're more likely to then address what actually brought them through our doors.
Thanks, Ben. Taryn, can you talk about what type of co-occurring disorders and co-occurring addictions that Ocean Drive treats?
I sure can. Many people who have substance use disorders also have mental health disorders and vice versa. And if you're wondering how common co-occurring disorders are, you should know that approximately half of the people who have one disorder will also have the other one at some point in their lives. We treat many types of mental health disorders and substance use disorders simultaneously. This can include depression, anxiety, bipolar disorder, PTSD, OCD, ADHD, sleep disorders, and chronic pain. Co-occurring addictions, otherwise known as addiction interaction disorder, are also often treated at Ocean Drive. Common co-occurring addictions can include alcohol or other drugs, and also addictions to food, gambling, sex, gaming, or other compulsive disorders. Our philosophy is that co-occurring disorders must be treated at the same time we're treating the substance use disorder. Otherwise, it's a vicious cycle of the individual finding themselves in situations that triggers their stress, their anxiety, their depression, and then they cope by self-medicating with drugs or alcohol or compulsive behaviors. And the one way to interrupt this cycle and to get the best results is to treat both disorders at the same time.
And Taryn, can you expand upon the treatment modalities that are used to treat co-occurring disorders at Ocean Drive?
Yeah, that's a great question. And the response will depend upon the clinical presentation of the patient. Typically, co-occurring disorders refers to the treatment focus of treatment on two or more conditions, as I mentioned, alcohol use disorder and depression, and to the use of multiple combinations of treatment to include evidence-based psychotherapies like CBT, DBT, ACT therapy for mood issues, and CPT or EMDR for trauma-related disorders, and and pharmacotherapy such as SSRIs and SNRIs for depression or anxiety, or medication-assisted treatments such as naltrexone for substance use disorder, only when clinically indicated.
Thank you, Taryn. This question asks, is Ocean Drive a primary program or is it more for relapse patients? Ben, why don't you take this one, please?
Sure. Ocean Drive's program is structured to be very individualized in nature, meaning that both patients who are brand new to the treatment program and those looking for guidance and help from a recent relapse will both benefit from our Ocean Drive programming, including compassionate care from our highly credentialed clinical and medical staff, including 2 topic-specific groups per day during the week, including groups such as DBT, family group, trauma group, relapse prevention group, spiritual group, process group, alumni and speaker group, and all of these groups Tara mentioned earlier in the presentation. We also have weekly individual sessions with both the patient's primary and family therapists. Ocean Drive's milieu is intentionally very small so that we can customize treatment for all patients, whether it's their first month or their fourth time in treatment. Alternatively, we also have progressive recovery workshops where patients are able to come back for 1 to 2 weeks of programming to clinically address what life has looked like outside of the treatment setting and to gain additional insight and support into any situations and or issues that have arisen. Progressive recovery workshops are often scheduled by the treating clinicians prior to discharge as part of the continuing care plan that all Ocean Drive patients are provided prior to discharge. We have alumni from years ago that still come back for annual workshops to continually strengthen their recovery and to stay connected with their treatment team.
Thanks, Ben. Next question wants to know what age is appropriate for Ocean Drive. Do you want to take that as well, Ben?
Sure. So I think when we look at the age question, I'm not sure that there's a particular age. We always look at the current milieu on determining, kind of what the right fit would be. Right now, specifically for Ocean Drive, the current age range is from 24 years of age to 65. And again, the treatment process at Ocean Drive is very individualized. And those people that are in the current treatment milieu are able to socialize accordingly. And again, we evaluate each case coming through the door to make sure that it will be appropriate for the treatment community.
Thanks, Ben. This next question, I can actually answer this one. The question wants to know, how will we differentiate who will go into which program? As Taryn and Ben both referenced earlier, we still have and will continue to have the Ocean Drive program that we've had now for 12 or so years in the Manor style homes. The Ocean Drive program at Keele is going to be separate from that. So what happens whenever anyone calls into admissions, we have an incredible admissions team that will get a lot of information about the patient, any co-occurring psychiatric disorders, medical complexities, and then we use a multidisciplinary team approach to review those cases to determine which program, whether within Keele Center, within Caron's continuum, or a program that's not affiliated with Caron, which program would clinically be the best fit for that patient and family. So as somebody referring into potentially Ocean Drive or the Keele Center, please do not feel like you need to make that determination. Just call us. We will get a lot of information. Again, we operate very much from a multidisciplinary approach with physicians, psychiatrists, psychologists, therapists, a lot of different types of professionals to determine what would yield the best results for that particular case. So we will handle that for you. Ben, this question, actually, this would be a great question for you, Ben, especially in your previous role with Ocean Drive. What kind of activities and outings does Ocean Drive offer patients?
Sure, thanks, Kelly. Ocean Drive offers a lot of strategic outings planned to help Ocean Drive patients experience real-world activities. We have outings and activities like golf, restaurants, concerts, art museums, and we offer these outings because we want them to experience what it's like to be sober while in a supportive therapeutic environment, and to help them through the clinical process. Many of our patients have never played golf sober, have never gone to a restaurant and not drank, and have never entertained clients without alcohol being present. We want them to have real life experiences while they're with us so they can determine which coping skills work best for them and can process the anxieties, cravings, anger about not being able to drink normally with their treatment team in real time versus being completely eliminated from these experiences while in treatment and then just hoping for the best when they get back home and they have to go at it alone for the first time.
Thanks, Ben. That's one of the many things I love about Ocean Drive's program. The next question is, Taryn, I will give this to you. What is the average length of stay at Ocean Drive?
So the average length of stay at Ocean Drive is 56 days. That's what we aim to complete. That's the amount of work we aim to complete with our patients who admit. And we pin it at that date because the first 2 weeks of anyone's stay here is them landing, getting settled into the community milieu, and completing a number of assessments from their primary therapist, medicine, psychiatry, on down the line, and then presenting that to them, all of the outcomes of those assessments within a 2-week period. And from there, we build the treatment plan. So that second half of that first month is organizing and defining that treatment plan, deciding on modalities, treatment modalities, and other types of complementary therapies to support that plan. And then going into that second month is when we start to introduce the family planning, the family aspect of our program that Ben was talking about earlier. So on average, it takes us about 2 months to get through some of the work. But of course, that's clinically driven, and we've had people stay for less or more time than that.
Thank you, Taryn. The next question wants to know, are all clients self-pay and what is the cost? I can answer that. Yes, Ocean Drive is a private pay program. In terms of what the cost is, it's based on which program they're going into, to Taryn's point, length of stay and some other variables. So please just call admissions and we can look at the case to see which program and what types of services they would need while with us. And then we could certainly give you or your client a cost for that. I think unless anyone else has a question on the live Q&A, looks like we have answered all of those. If you do have any more questions and you didn't have the opportunity to ask it today, please follow up with any of us and we will certainly get those questions answered. And thank you to those of you who joined us today to learn about Caron's expanded Ocean Drive program at the Keele Center, which again, we are scheduled to open in early 2023. We hope you'll join us for the next webinar in our Countdown to Keele series, which will be on September 21st. And in this one, we are going to take a much deeper dive into the older adult program that is coming to Florida. Additionally, please watch your email for other educational opportunities and events from Caron, specifically our continuing education webinars. And lastly, please register for our 7th annual Addiction Research Symposium, which is taking place on November 4th. We have both in-person options as well as virtual options for the program. It's approved for AMA, PRA Category 1 credits, and it's just an incredible, brilliant group of researchers in the industry talking about things that will be impacting us for many, many decades to follow this. So thank you again, and please enjoy the rest of your day. Take care.
Thank you all.